All right, this is chapter 11, recording number 3, and we're talking about different medications that we give specific routes. Sublingual medications. The advantage is that it's easy to talk with awake and alert patients, and they can very easily put the pill underneath their tongue or the spray, which you can see up on the screen as well. Your head and face receive a lot of blood, so your absorption rates are pretty quick giving a sublingual medication. Disadvantages: anytime you put a medication in the mouth, you have to constantly evaluate the airway. You also need to be alert to any choking on the pill. It's less likely with sublingual because they dissolve pretty quickly, but still. Um, and it shouldn't be used in a patient if they're uncooperative or if they're unconscious. Nitroglycerin, many cardiac patients have nitroglycerin to relieve anginal pain. This does not fix heart attacks. It's only when the muscle is starved for oxygen from some reason other than a clot. It increases blood flow by relieving spasms that cause the arteries to sometimes become constricted, hence causing ischemic chest pain. This will actually dilate those by relaxing the muscles of the arteries and veins so that more blood can get into that specific area. It also relaxes veins throughout the body. You also have less blood returning to the heart, a decreased workload, which decreases blood pressure. So they do have to have a minimum blood pressure in order for you to give this medication. Before administration, you need to check blood pressure. A systolic pressure that's less than 100 may have harmful effects if you give them this medication. It could bottom out their blood pressure. So we definitely don't want to do that. If they have an adequate blood pressure, we still want them to be seated or lying down just to make sure that they don't end up fainting from a quick drop in their blood pressure. And this will hopefully keep them from feeling dizzy. If you need to, excuse me, make sure that you obtain orders. Just follow your local protocol for how to give that medication. If nitroglycerin doesn't actually bring relief to the patient, it could be that they're experiencing an MI, myocardial infarction, or heart attack rather than angina. It won't relieve that. You can always double check with them, say, hey, how much of this medication has been needed in the past for you to actually feel some relief? And if they say, normally I take 1, I take 2, and I'm much better, and you've given them 4, then you know that something's not the same for them. It can have potentially fatal interactions with erectile dysfunction medications, so ED meds. If those medications were taken in the last 24 hours, some common erectile dysfunction medications are sildenafil or Viagra, tadalafil, Cialis, or vardenafil, Levitra. Keep in mind that erectile dysfunction medications may be used in both men and women. They've found some other effects that those medications can have that have no dealings on an erection. So a female could be on it as well. So make sure that you ask what's going on and if they've had any of those medications within the last 24 hours. If they had, that's a contraindication. So effects we've kind of talked about a little bit: relaxes muscular walls of the coronary arteries and veins, decreases blood pressure, often causes a headache, can also cause a burning under the tongue. That's normal. For administration, typically it's going to be either by a tablet or a spray that you put right underneath the tongue. They should experience a slight tingling or burning sensation. That definitely means that the medication is working. This medication is highly sensitive to sunlight. So if you'll notice the bottle on the previous page, and I'll go back to it, it's a dark colored bottle to protect it from light. Red is also a color that doesn't let light in all that well, so trying to protect that medication. If they don't feel that tingling or burning, it could be that the medication has lost its potency or it's past its expiration date. So just be very careful with it. Any exposure to light, heat, or air could cause it not to work anymore. If you use the spray, one spray has the same amount of medication in it as one tablet. So if you're typically going to give one or the other, but the patient often has the tablet. So if you give them one of their tablets to begin with and then switch over to using your spray, know that one tablet equals one spray of the medication. You want to wait 5 minutes for a response before repeating the dose. And before you ever repeat a dose, you need to recheck vital signs, most importantly, blood pressure. You can give repeated doses per medical control and or your local protocol. Always, always, always wear gloves. The medication can be absorbed by your skin and you truly don't want nitro. Reconfirmed if the medication is still indicated for the patient. If their pain is relieved, you don't need to keep dosing them up. Intramuscular medications that can be given by EMTs. The advantages of intramuscular provides a pretty quick, easy access to the circulatory system, but you don't actually have to put a needle in the vein for that to happen. Blood flow to the muscles is pretty stable for the most part, even during circumstances of severe injury or illness. The disadvantages is that you have to use a needle, and so you get the pain and the fear of actually using the needle. A lot of patients don't like needles, and so this is going to increase their anxiety. One medication that we often use that's given IM is epinephrine, also known as adrenaline. Your body naturally releases this when you're under stress. This is the primary medication that an EMT will deliver IM. It's in a class of drug called a sympathomimetic because it mimics the effect of the sympathetic nervous system, which drives that fight or flight response. The effects of epinephrine, it increases heart rate, it constricts blood vessels, which ends up causing an increase in blood pressure. It dilates the passage of the lungs, so it causes bronchodilation so that you can breathe better. This is particularly helpful in asthmatic or allergic reactions. And then one of the side effects of an allergic reaction is that it drops your blood pressure, so this will help bring that back up. Should not be given to patients who have hypertension or high blood pressure if they're suffering from hypothermia, so their body temperature is too low. If they're experiencing a myocardial infarction or a heart attack, because you're going to end up speeding up the heart, the muscle itself is going to need more oxygen to work correctly, but you're not getting that oxygen to the muscle because there's a clot involved. And it'll make that infarct much worse than it needs to be. And if they don't show signs of wheezing or airway obstruction that's due to an allergic reaction, you'll not be giving epi. You can administer epi by injection, which is only permitted in some states, so make sure wherever it is that you're working that you know if you can give it or not. It's used to treat life-threatening anaphylaxis, which is the most severe allergic reaction that a person can go to. Typically, this is going to be from insect venom or other allergens that cause an over-release of histamine in the body. What histamine does is it reduces blood pressure because it makes all of those capillaries extra leaky, so fluid ends up draining from that. Causes wheezing, wheezing from bronchial spasms, and then also causes swelling of the airway through edema, so it makes it harder to breathe. When you give epi, it directly reverses the effects of the histamines. It constricts those blood vessels, which allows your blood pressure to rise. It reduces swelling by dilating those air passages so that air can get into your lungs a lot easier. You might have epi in an auto injector. So EpiPens, this automatically delivers usually 0.3 milligrams of epinephrine per auto injector. Side effects of epi causes a burning sensation where it's injected, and it will increase the heart rate. Some services don't allow for the EMTs to carry EpiPens, but if the patient has one, you can assist them in taking their own epi. So if a patient has a severe allergy, you may want to ask them if they have an EpiPen available. Naloxone is also known as Narcan. You can give naloxone by injection. You can see on the screen that they're actually giving it intranasally. When you give it by injection or intranasally, it has the same effect. So it's used to reverse the effects of an opioid overdose. Make sure that you know that the patient has an opioid overdose. First and foremost, there's a couple of physical signs that you can get with that. Constricted pupils, slow breathing rate, and we're really doing this for patients that have life-threatening opioid overdoses. If they're not super terrible, you don't want to be wrestling with a patient in the back of the ambulance. So we're not trying to take their high completely away. We just want to make sure that they start breathing normally. So it's one of the side effects of opioids is that you don't breathe fast enough, and then it can lead to death. You want to consult medical direction to make sure that you're allowed to administer Narcan. Typically, it's going to be right in your protocols if you can or can't. Find out if Narcan has been administered by a bystander prior to you getting there. You can buy this over the counter now without a prescription. You have to talk to the pharmacist to get it, but people can be hanging out with this in their pocket or in their car. Police officers do carry it as well, so just want to make sure that we know how much the patient has been given. The effects of the Narcan itself don't last as long as those as the opioid. So this will go in and it will block receptors so that that medication that they've taken, that opioid that they've taken, can't actually attach to receptors and stimulate them. But the Narcan will wear off well before the opioid medication. So those Narcan molecules will start falling off of the receptors as your body starts getting rid of it. And that allows the opioids to bind and then stimulate that receptor. So oftentimes you have to treat somebody more than once, maybe not in the field with a short transport time. You definitely need to let the hospital know because there's a huge chance that they're going to have to give it to the patient a second time. We don't want to completely take away their high. Like I said, it can actually cause severe withdrawal symptoms, which make everything worse. Severe rapid withdrawal can cause seizures and cardiac arrest. So we just want to give 0.4 milligrams increasing until the patient starts breathing normally. And then we stop because we don't want to, again, wrestle with our patient. The most common way for us to administer Narcan is through the nose, like you see on your screen. So you want to take a half dose, so 1 ml max, into each nostril. So you're kind of splitting it up. You're going to always use the atomizer, which is that big white thing that they actually have stuck in his nose. You don't use needles for intranasal. And we'll go ahead and stop here and continue on to the next recording.